New videos every day.
Okay, and continuing on, we're going to be doing, we just finished this side. I stopped on this side, so you're on the left side of the body. Then we're going to move to the legs. The axillary, this is the inguinal area, and there's a lot of nodes in this area here. The flow will move in this direction and up toward the back and up into the nodes, and then we want to just push to get it open the rest of the way up. So we just start that the same way that we have, where we're in the bend of the leg, and there's a lot of nodes in here. And the action is kind of a down and up and over and up. It's kind of hard to explain the directionality because there's several different moves that you do inside of there. And that's where having somebody doing it with you in an instructional thing is a little bit easier than learning it just from a video. But again, this will help you to drain simple things, give some ease to swollen ankles and maybe swollen feet after sitting a long time at a desk or something like that. So again, it's just the skin stretching, pads of the hands, moving up. Now I'm back here behind the knee. And go back up here, and we're going to push this in this direction. And I wrap my hands pretty far back on the leg here, simply because I can pull a lot from the back forward. You can see how the skin is moving, how it's being pushed up, and swollen feet and swollen ankles oftentimes occurs from sitting at desks or at computers, because there's so many nodes here and it can't drain when there's been a crimping of these lymph vessels from sitting. And if we wear tight underclothing or tight pants, we're going to cut off the circulation, or not the circulation so much as the flow of the lymph through those vessels and through those nodes, just by positionally squishing them. So be mindful of that. If your leg or foot is swelling a bit and you do spend a lot of time sitting, check that out and maybe get up and move or stretch your leg out and put your foot up on a chair or a stool. And you just move down the leg. It's really the same technique, just down the leg. And because I'm not getting real specific, or I don't need to get real specific about a particular area, everything's going to move a little bit easier. And so I broaden the hand, and I just do cover a lot more area of vessels and move it. If I feel an area needs a little different work, then I'll stop and pay attention. Ideally, people should just come in for this every couple of months, or a month or 2 months, depending on their situation, and just keep the lymphatic system in good working order. It does a lot of work. It's responsible to carry toxins out, and we are in a very toxic environment right now because of all of these things going on in the world, plus just our food and water is pretty toxic. So it's important to keep our systems in good check. And there we go for that leg, and it's all flowing well. And then I move to the other side. Go with this same thing, getting the This side feels a little bit tighter, a little more congestion in the nodes. There's a pretty big node here. Looks like I'm going deep, but I'm really not. I'm going right into the water. When we get lymphatic work done, because we're helping the fluids to move through the nodes, a lot of the immune cells, they hang out in the nodes and they can do their job pretty good when things pass through there. But if the lymphatic fluid is getting a little gelatinous and harder to move, then the immune system is compromised. So by allowing the lymph system to be in good working order, would mean that like an unintended cause or effect of that would be a lymphatic system that's going to be working a little bit better. I don't know how the cameras are working here, so let me try to stay out of the way. And then under the knee. And down the leg. Same thing. Just push up into the directionality, the way that it flows, and just help it along. You're giving it a little friction, so if there's any stuckness, that friction warms it up and helps it to move a little bit better. The foot. And you probably are able to see how the skin is moving. And there we go. I'm going to show you one little thing. We're just draining the rest. And remember, the skin stretching is simply gliding your hand upward and then letting it go and sliding back. It's a slide up and a slide back. Very shallow. You're just really on the skin. The fluid is right underneath it. So that's the technique for pushing with the pads, all the pads on the hand, gliding it up. Just be sure that you take it into the direction of the major nose where it flows. And for relatively healthy people, you'll do a great job. Once again, if anybody's sick, has a condition you're not sure of, do not do the lymph work until you find out what's appropriate, because there are contraindications with lymphatic work. Thank you so much. This is Athena Jezik. Feel free to email me if you have questions.
If you liked this video, we have hundreds of more alternative videos ranging from sexual health to psychology to mind control. So if you liked it, go ahead and click on me to enter the Psychetruth channel.